Most seniors forget to clean this, and it could trigger a stroke. Have you ever thought that something as simple as your toothbrush could actually help prevent a stroke? Most seniors focus on the big things: blood pressure, cholesterol, diet, exercise. But there's one quiet part of the body that often gets ignored. And when it's not cared for properly, it can silently raise your risk of stroke, memory loss, and even loss of independence. I'm talking about your mouth. Yes, your gums. You see, your gums aren't just there to hold your teeth in place. They're deeply connected to your heart, your brain, and your entire circulatory system. But for too many seniors, gum health is an afterthought until it's too late. In today's video, we're going to uncover 6 hidden dangers that start in the mouth, but don't stay there. And you'll see how small changes in your daily routine could make a huge difference in protecting your long-term health. So if you've ever shrugged off bleeding gums, if you've ever ignored a sore spot, or felt like brushing doesn't matter anymore, stay with me. Because what you learn today might just change the way you care for yourself from the inside out. Let's begin with the most surprising connection of all. How gum disease, something most people don't even feel, can quietly raise your risk of stroke. Part 1. Gum disease and stroke risk. Let's start with something that surprises most people. Gum disease isn't just about your teeth, it's about your brain and your heart, and it may quietly double your risk of having a stroke after age 60. You see, when gums are inflamed, what dentists call gingivitis or periodontitis, it's not just staying in your mouth. That inflammation travels. Bacteria from your gums can enter your bloodstream. Your immune system reacts by sending out tiny chemical messengers called cytokines that cause inflammation throughout your entire body. Over time, this quiet, chronic inflammation can weaken your blood vessels, especially the delicate ones in your brain. That's exactly what happened to Joe. Joe was 68, retired, active, and by all accounts, healthy. He walked every morning, took his medications, ate pretty well, but for years he noticed his gums would bleed a little when brushing. Nothing major. A little pink in the sink. He chalked it up to getting older. Then one morning, while making breakfast, Joe suddenly dropped his coffee mug. His right arm had gone numb. He'd had a stroke. The doctors were puzzled. His cholesterol wasn't bad. His blood pressure was under control. But one thing stood out. His inflammation levels were sky high. And the likely source? Chronic gum disease he never treated. Unfortunately, Joe's story isn't rare. A major study published in the journal Stroke found that seniors with advanced gum disease were twice as likely to suffer a stroke, even if they didn't smoke or have diabetes. But here's the good news. Gum disease is preventable, reversible, and often it starts with paying attention to one small but very telling sign: bleeding gums. So let's talk about that next. Because bleeding, even a little, may be your body waving a red flag. Part 2. Bleeding gums are not normal. Let's be clear about something that many older adults have been told, directly or indirectly, for years. Bleeding gums are not just a part of getting older. They are not normal. They are not harmless. They are a sign of infection. Unfortunately, many seniors see a little blood when brushing or flossing and think, oh, that's just my gums being sensitive. They wipe the toothbrush, rinse their mouth, and move on. But what if that tiny bit of blood was actually your body's way of warning you? What if it's not just aging, but active inflammation, trying to get your attention? Let me tell you about Margaret. She's 72, retired, sharp as a tack, and proud of her independence. She brushes every day, keeps her home spotless, loves her garden. But over the past couple years, her gums started to bleed, just a little, when she flossed. No pain, no swelling. Just that faint pink every now and then. She figured it was nothing. Then one afternoon, while putting away groceries, she felt dizzy. Her left hand felt tingly and weak. At the ER, doctors told her she'd had a mini stroke, what they call a TIA. Her scans were clear, but her blood work told another story. High levels of inflammatory markers. When the doctor asked about her dental care, Margaret admitted she hadn't seen a dentist in nearly 4 years. Here's what the science says. When your gums bleed, that tissue is no longer sealed. It becomes an open door for bacteria to enter your bloodstream. Those bacteria travel, irritating your arteries, raising your stroke risk, and possibly even affecting your brain. So please, don't brush it off. Healthy gums don't bleed. Not at 60, not at 80. If they do, it's a signal worth listening to. The good news? Small changes can make a big difference. Use a soft bristled toothbrush. Brush with small, gentle circles along the gum line. Floss carefully, but consistently. Warm saltwater rinses can calm inflammation and kill surface bacteria. And if bleeding happens more than a few days in a row, see your dentist. Because sometimes the smallest signals are the ones that save us. And if you think this only affects your heart or your stroke risk, think again. In the next section, we're going to explore how bacteria in your mouth may be reaching places you'd never expect, like your brain. Part 3. Mouth bacteria and memory loss. We often think of memory loss and cognitive decline as something that just happens with age. But what if part of the problem isn't in your head? What if it starts in your mouth? Recent studies have shown that the bacteria responsible for gum disease, especially Porphyromonas gingivalis, don't always stay in your mouth. They can travel through your bloodstream, pass through the blood-brain barrier, and trigger inflammation inside your brain. And that inflammation? It disrupts the way your brain cells talk to each other. It slows your recall, clouds your thoughts, and over time may contribute to conditions like Alzheimer's disease. Let me share John's story. John is a 74-year-old Vietnam veteran, tough as nails, still proud of building his own home by hand. But over the last couple of years, something started to shift. He began forgetting appointments, getting lost on the way to his daughter's house, a route he'd driven hundreds of times. At first, everyone thought it was just senior moments. But when his doctor examined him, something unexpected came up. John hadn't been to a dentist in over 6 years. His gums were swollen, bleeding, and full of infection. Blood tests showed signs of neuroinflammation, inflammation inside his brain. Not from injury, not from genetics, but likely from bacteria entering through his gums and triggering an immune response in his nervous system. In fact, researchers from Harvard and the University of Illinois found the same gum bacteria in the brains of patients diagnosed with Alzheimer's. It's a startling connection, but one we can't ignore. Here's the hopeful part. This isn't inevitable. You have the power to protect your brain every single day, starting with how you care for your mouth. Brush thoroughly, especially along the gum line. Floss gently to remove hidden bacteria. Use an antimicrobial mouthwash designed for seniors. And if you wear dentures, make sure they're cleaned properly every day. We'll talk more about that soon. Because your mouth is more than a smile. It's the gateway to your brain. Now, while we're on the topic of bacteria, there's one condition that makes the mouth even more vulnerable. It's something millions of older adults live with every day, and most don't even realize how dangerous it can be. Let's talk about dry mouth and why it might be putting your health at risk. Part 4. Dry mouth and medication. Risks. Dry mouth may seem like nothing more than a mild annoyance, a little discomfort, maybe some trouble swallowing or speaking clearly. But for older adults, dry mouth can quietly open the door to serious health risks. You see, saliva isn't just there to help you chew. It's part of your body's natural defense system. Saliva washes away bacteria, keeps tissues moist, and delivers antibodies and enzymes that protect your mouth from infection. But as we age, and especially when we're on multiple medications, saliva production often slows down. In fact, over 400 common prescriptions, including those for blood pressure, heart conditions, depression, and allergies, can cause chronic dry mouth. And when that protective barrier disappears, bacteria flourish. Let me tell you about Anna. She's 75, active, and incredibly disciplined about her health. She takes her medications on time, walks every morning, and never misses a doctor's visit. But for years, she quietly struggled with dry mouth. Her tongue felt like sandpaper. She'd wake up at night thirsty. And she started noticing a strange taste in her mouth, especially after taking her morning pills. She never thought much of it. Until the morning, she slurred her words and couldn't feel the right side of her face. Anna had suffered a minor stroke. At the hospital, doctors found that her mouth had high levels of harmful bacteria and signs of inflammation traveling through her bloodstream. The likely cause? Dry mouth left untreated. Here's what you can do. Stay hydrated. Aim for 6 to 8 cups of water per day, unless your doctor says otherwise. Chew sugar-free gum with xylitol. It stimulates saliva production. Use mouth sprays or lozenges specifically made for dry mouth. Many are over-the-counter. Avoid alcohol-based mouthwashes. They make dryness worse. Most importantly, talk to your doctor or pharmacist. Ask, are any of these medications causing my dry mouth? Is there an alternative? Dry mouth isn't just uncomfortable. It's a warning sign. And the sooner we act, the more we protect our mouth and our brain. Now let's talk about something many older adults use every day, rely on even. But if not cleaned properly, it can become a serious health threat. Let's explore the hidden dangers of dentures and how to care for them safely. Part 5. Dentures and infection risk. For many seniors, dentures are a symbol of freedom. They restore our smile, let us enjoy our favorite foods again, and help us speak with confidence. But here's something few people realize. Dentures, if not cleaned properly, can become a breeding ground for harmful bacteria and fungi. And that buildup can lead to chronic mouth infections, which, over time, affect the whole body. Let me introduce you to Walter. He's 80, a retired mechanic, and proud of how well he's adapted to life with full dentures. He always kept things simple when it came to cleaning. A quick rinse in warm water, maybe a little soap once or twice a week. But then he started noticing a sour taste in his mouth, slight swelling in his lower jaw, and one day he woke up with a fever and tenderness under his tongue. At the hospital, doctors found he had a bacterial infection in his mouth, and those bacteria had entered his bloodstream. His inflammation markers were dangerously high, and just like that, his stroke risk had spiked. Here's what was happening. When dentures aren't cleaned daily, bacteria form a sticky layer called biofilm. This biofilm holds on to germs like candida and strep, which can irritate the gums, enter the bloodstream, and fuel systemic inflammation, the same type that raises stroke and heart risks. Here's how to stay safe. Clean dentures every single day. Not just with water, but with a denture-specific cleanser, not toothpaste. It's too abrasive. Brush gently with a soft denture brush to remove food particles and plaque. Soak overnight in a disinfecting solution to kill lingering bacteria. Clean your gums and tongue daily too, even without natural teeth, using a soft cloth or brush. And of course, visit the dentist twice a year for professional cleanings and checkups. Walter made the change. He now soaks his dentures every night, brushes them carefully, and rinses with salt water twice a week. He told me, "I thought my age was making me feel sluggish. Turns out, it was my mouth." And what surprised him the most? His energy returned. His thinking became clearer. His mouth felt healthy again. Because when we clean our dentures properly, we're not just protecting our smile. We're protecting our whole body. Now, maybe you've noticed a pattern in today's video. Whether it's bleeding gums, dry mouth, or unclean dentures, there's one hidden force tying them all together. Let's talk about that next. Inflammation. The silent threat that so many of us never feel until it's too late. Part 6. Inflammation. The real enemy. If there's one thing connecting everything we've talked about so far, bleeding gums, dry mouth, unclean dentures, it's this: chronic inflammation. Doctors sometimes call it the silent killer. Because unlike sharp pain or high fevers, inflammation doesn't always shout. Most of the time, it whispers. You feel a little off, a little tired, maybe a little foggy. But under the surface, your body is fighting a slow-burning war. Here's what happens. When harmful bacteria build up in the mouth, your immune system responds. It sends out inflammatory chemicals, like tiny alarm bells, through your bloodstream. These signals damage the inner lining of blood vessels, make arteries more fragile, and increase the risk of plaque buildup and clots. Over time, this weakens your heart, strains your brain, and raises the risk of stroke, dementia, and other chronic diseases. Let me share Carol's story. She's 69, a retired librarian, always active and thoughtful about her health. She ate well, took her walks, stayed socially connected, but she hadn't seen a dentist in years. Her gums were tender, a little puffy, but not painful. Then, one afternoon, she had trouble finding her words. Her doctor ran blood tests. Her C-reactive protein, a marker for systemic inflammation, was abnormally high. The cause? Oral inflammation, quietly brewing for years from unaddressed gum disease. Here's the truth, William. You can't see inflammation, but you can stop it. And it doesn't require magic pills or complicated treatments. Just small, steady habits. Brush and floss daily with care and patience. Clean your dentures every night. Stay hydrated. Use mouth sprays if needed. Visit the dentist regularly before problems grow big. Eat foods that reduce inflammation. Leafy greens, berries, fatty fish, olive oil. Every time you care for your mouth, you're calming that fire inside. You're telling your body, I've got your back. Now, let's take a breath and pull all of this together. Because what you've just learned could change the way you care for yourself every single day. Let's close with some reflection, encouragement, and a reminder that it's never too late to start fresh. Wrap up. Take back control, one brush at a time. Let's take a quiet moment to reflect. We've covered a lot today. And if you're still here, that tells me something important. You care about your health, your mind, your future. We started with a simple idea, that what happens in your mouth doesn't stay in your mouth. We saw how gum disease can double your risk of stroke, how even a little bleeding could be your body waving a red flag, how mouth bacteria can travel, sometimes all the way to your brain, how dry mouth from medication opens the door for infection, how unclean dentures can trigger inflammation that affects your whole system, and how, at the center of it all, is chronic inflammation, the silent enemy most of us never feel until it's too late. But here's the most important thing to remember. Every single one of those risks can be reduced, starting right now. You don't need to overhaul your life. You don't need to be perfect. You just need to start. Maybe today it's as simple as brushing a little more carefully, drinking another glass of water, or picking up the phone to schedule a dental checkup you've put off for too long. These aren't just hygiene habits. They're acts of self-respect, of strength, of protecting the independence, dignity, and clarity you've worked so hard to keep. So if this video has made you pause or think differently about your daily routine, leave a comment in the comments. I'd love to know what part resonated with you most. And if you found this helpful, please consider sharing it with someone you care about. It might be the gentle nudge they've been needing. Because living longer is one thing, but living longer with energy, with memory, with joy in the little things. That's the life you deserve. Stay well, stay wise, and never stop brushing, because your future may just depend on it.